this is the operation starring Bonnie Simon, the bestest kid in the world, taken by the second bestest kid in the world, my grandson Drew. These are the gauze pads that we use to clean her eyes. These are the sensitive eye drops that I use on the gauze pads. Okay? Okay. She has 2 bottles of these, which are Refresh Tears, which is just to wash the gunk out of her eyes. Okay. This is the medication that she's using at the moment, which is called Optimune. And we have to put it in twice a day, morning and night. Okay. This is a bag of all of the medications that she has been on so that your vet knows what we've used on her. Okay. And these are treats. And you never guess what these are for. Okay. So Daddy is holding the dog. Grandpa is holding the dog. And first we find the tears. And we get a little gauze pad. This is Sonny. He's watching to make sure I do it right, because it's very difficult to do these things correctly if you don't have the right supervision. But I suspect you have supervision at your house too, so I'm not too worried about it. Of course, you have to be brighter than the cardboard box in order to get in it. I usually use 2 of the drops, the cloths. The first one I use, hold her hand, her eye open with my hand, and drop the drops right in it. And then kind of wipe it out. Now she hasn't been done. She would normally have been done earlier today, but we needed to get somewhere and get Drew to help us. And then we do the other eye. No, hold it up now, darling Bonnie. This little drop. And clean it with a different part of the pad.
I'll show the gunk on the pad.
Yeah. And this is a day's worth of gunk. Okay. Then we take her sensitive tears. And another pad. And just wet this down fairly thoroughly. Now, her left eye, if you look at it, it's real. She doesn't want to open it, but it's really pretty good. So, you know, once a day is usually enough for her, and she doesn't have the gunk. But this is the one, the right eye, that has so much trouble. So I wash it very gently with the sensitive tears, trying to get all the gunk that didn't get washed out. And she's usually very, very good. Okay, so having done that, we've now basically washed the eye twice. I don't bother with this eye the second time because it's really healed up amazingly well. Take the Optimune. The only thing to be careful with this is be very, very gentle when you squeeze it. Otherwise, you have a long sausage of ointment for a very tiny eye. And there's no way to get the stuff back in the tube. So again, I hold her eye open with my finger and thumb and just put a little tiny bit along her lower lid and close her eye and just rub it very, very gently. And see, she doesn't seem to mind at all. I think she knows it feels good. Feels better, doesn't it, when we put this stuff in your eyes? And I'll put some in here just at the same time, although by the time she comes to you, I suspect that she won't need anything done to her left eye, just her right eye. And now, what time is it?
This is the important part.
What happens now? Where is everybody else? Daisy May,
It's right behind you.
Dawn. Okay, have you been a very good girl? And you can get 2. And you, have you been a very good boy? Okay, you can get 2 as well. And this is Dawn, who is Sunny's sister. You think you should get 2? Uh-oh, uh-oh. And here's Daisy May. Where's the other one?
Lexi isn't around, but
Okay.
she misses out.
Would you like another one because you've been a very good girl and you've been starring in your own film? There you go. Okay,
Okay.
great.